Hi, everybody. Welcome to Pensacola Mom Collective's Bloom 2021 event. We are lucky enough to have Amber Price with us today. Amber is a certified nurse midwife at the hospital, Ascension Sacred Heart. She is board certified in midwifery by the American Midwifery Certification Board. She provides personalized, compassionate prenatal care and follow-up care for women desiring natural, low intervention birth experiences at the hospital. She has a special interest in education, supporting and showing women that they can have home-like births in a hospital atmosphere. And she has more than 13 years of experience in labor and delivery. Outside of the office, Amber loves to travel, exercise, weight lift, and spend time with her husband and 4 daughters, which is amazing. Thank you so much for joining us. We just want to share your knowledge for those who do not know what that means, what that looks like, and this wonderful offering that we have at the hospital today, which they did not have when I had kids. So I'm excited to learn about it. Thanks for joining us.
Yes, thank you for having me.
Yeah, I just wanted to start with just telling everybody a little bit about what your role is as a midwife, maybe kind of filling in people who don't know what exactly that means here at the hospital.
Sure. So basically, as a certified nurse midwife, we were nurses first. So you have to have a bachelor's in nursing. And then you go on, we have a master's program for advanced practicing nurses. We take the boards nationally, as you mentioned. And then we are board certified as midwives, but we have our master's in, nursing. So basically, our role is we serve as the primary provider for OB/GYN. Here at Sacred, we're strictly doing obstetrics only. So we're only doing pregnancy, delivery, and postpartum. We will be adding in GYN services soon, but our role is to be there with the mom throughout the whole pregnancy, support, be there at birth, participate in the delivery, and then follow up with postpartum care.
That's fantastic. How many midwives do you guys have at the hospital?
So now we have 3. We have grown. We went from 2 to 3. So we have Ashley and Alyssa also.
Great.
3 A's just to make it nice and confusing.
You'll get someone, someone with an A. So I know we previously wrote about your low intervention birth suites at the hospital, but tell us a little bit more about those, kind of what they look like and what it means for moms when they deliver at these locations.
Yeah, so the nesting place or the low intervention birth suites, it is still attached to the labor and delivery floor. So it's not a separate building. It's not detached from the hospital. Okay. But the nice thing is, it is kind of back secluded, and it really does feel like you're in a whole different place. It's very quiet. The whole just decorations are different. It doesn't feel like a hospital. We have 5 rooms. 3 of them have tubs. All of them have the birthing balls, peanut balls, birthing stools, all the different equipment that you can get on the regular floor too. But the real difference is just the quietness of it. And there is, very specific criteria that you do have to meet to be back there, such as you must be 35 weeks or more. We should not anticipate NICU being at delivery. We are actually able to do some inductions now. I fought very, very hard to get them to change that. So we can't do medical inductions, but we can do, non-pharmacological inductions, which we're huge with. We try to do those enemas, different things besides just going straight to medication. Also, we encourage you to get up, move, walk. That's, intermittent monitoring. You can labor in the tub, all those things. We do not actually want you stuck in that bed laying there.
Awesome. This sounds incredible. Is there different kinds of music that you can pick to play? I thought I had heard that at one time.
There actually are speakers there, but it's pretty much noisemakers. But what we encourage most of our people to do is bring their own Bluetooth speaker, and then you just pick up your own playlist. Yeah.
I didn't even think about that. That's awesome. Well, so when we were kind of chatting about this and trying to learn more and wanting, moms in our community to learn more, I think there's some myths around midwifery. And so I just wanted to run through a few that were brought to our attention, and then you can kind of address them and just to kind of clear the air for everybody out there. The first one I have is that you only deliver at home, which
definitely not. Yeah, we hear all these myths all the time. So it's actually fun to address them. And, there are midwives that only deliver at home, which that's great. I mean, you definitely can have a safe home birth under the right trained personnel, but we do not. We only do hospital births by choice. So we have the safety of the hospital in the background, but we still want you doing all of those things in the hospital.
That's fantastic. And midwives do not have any formal training like physicians, which I know you covered, but how would you respond to that?
Yes, so that is definitely not true. A lay midwife, that is true. They do not have formal training, but as a certified nurse midwife, we have our bachelor's in nursing, we have our master's in nursing, and then we are nationally accredited and certified through the AMCB. And we did, lots and lots of clinical hours, lots of training to get where we're at. And we have to keep up those CEUs, just like any nurse and doctor and all that continuing education.
And I know you even mentioned previously, like you were nurses first. So you've done it before you then moved on to the next one, which is awesome. Yeah. Nothing better than that. Okay, so the other one is kind of something that no one wants to think about, but you always have to consider is, should the unthinkable happen, a physician wouldn't be present to assist with delivery?
That's a great question, because we absolutely always have 24/7 physician coverage. So in our office, we have our collaborating doctor, Dr. Gillum, who's amazing. She's very supportive of all the crazy things we do. But she's there kind of in the background if we need any office type backup. And then in the hospital, we have the OB hospitalist group is our backup. So 24/7, we've had them, do emergency C-sections. We've had them come just double check maybe if a patient needs a more extensive repair or, postpartum hemorrhage, shoulder dystocia, all the emergencies that can happen. They're just a very quick down the hall phone call away.
Right. Which is great, because you never, obviously you don't want to think that when you go into it, but, things happen, and to know that you can have the, that experience that you want. And then should that happen, you have somebody right there available.
Right. And I will say, because we've also heard some people be like, oh, but do you actually deliver the baby? Yes, we absolutely deliver the baby. And 95% of the time, you probably would never even see our doctor, and that's ideal, but they're there if we need them.
Right. That's awesome. So the last one I have is midwives and doulas are the same thing.
Yes, I hear that at least every week.
I bet you do, because I kind of thought the same thing in the beginning until I learned more about it.
Oh yeah. A lot of my friends that I've been friends with forever, actually I had one the other day who was like, oh, but what exactly do you do? I was like, well, I'm glad you finally asked. So doulas are awesome. Nothing against doulas. We love doulas. We work very well with our doulas. But doulas, they are actually, I can't even speak exactly 100% how they get their training and certification, but I know they have their own entity that they get their certificates from. But it's nothing that is no formal education required, no experience required, no boards required, that type of stuff. So
all of that angle is done in the home.
That's for a doula. Doulas can still come in the hospital. But the difference, even at home, doulas are not certified whatsoever to deliver a baby. So they are non-clinical. They're there for support. Which is awesome. I mean, very helpful. So they're there as basically your stand-in support person. They offer, different postpartum and prenatal education also, but they're not clinical. They should not be checking your cervix. They should not be, monitoring baby. They aren't delivering babies, that kind of stuff.
Got it. I'm glad you explained that, because I really was curious.
And we actually encourage a lot of our patients to get doulas, but the difference with us compared to a lot of other providers is when you're in active labor, we're coming in with you. We're there. and we're staying with you until that baby's born. So,
and then I imagine like a doula kind of just being your coach up by your head.
Yes.
You got this, you know, if you don't have a spouse or he's not available or, you know, something, this is what I'm imagining in my head. So maybe.
Yeah. Helping them change positions, you know, all those things.
Yeah.
They're kind of there at the bedside without leaving.
Yeah, I think this is so amazing. I mean, honestly, I have a 10-year-old and a 7-year-old, and I just feel like we've come so far since then and talking about it and having these availabilities, which shout out to you guys and the hospital, because that's fantastic.
Yeah.
You know, you go into those moments as a mom, as a new mom, even second, third, fourth, you know, and on children. And it can be scary. The nerves of the unknown can really be. So having these little things that make it extra special, or we're so fortunate for. So thank you for what you do.
You're welcome. And that's honestly why we are here is we're here to support women and to show everyone that this is a normal physiological process. It's not a medical procedure, you know. We didn't really talk about this, but we love VBACs, people that want to try a vaginal birth after C-section.
Yeah.
So, I mean, you have to meet certain criteria, obviously, to be a safe candidate, but we're all about it. We're supportive of it. But it really comes down to, we're not here to tell you what to do. We're not here to, oh no, you need to do this. We don't use fear tactics. It's all about educating, being safe, and coming up with a plan and shared decision making.
I love that. I love that. You know, starting Pensacola Mom Collective, that's exactly our mission, is educating, empowering, encouraging. And I feel like that's what you guys do in the, you know, birth. And then, you know, from there, you keep in touch with those people and keep moving on. Well, just to close, if you had one piece of advice for a new mom or an expectant mom listening about what you do and what to expect from it, what would you want to share with them today?
That is tough. I honestly would say I really strongly encourage everybody to just trust your body, you know,
Love that.
And also to be very open-minded. I mean, we need to come in with a plan. We need to be prepared, but we need to also realize not everything goes 100% as planned. And even though our bodies are meant to have babies, you know, there are complications. There are sometimes things that interrupt that process, but just trusting yourself, trusting your body, and just kind of going with the flow and you know, trying to keep that anxiety of being a new mom at bay. That's tough.
They're not alone in that. No.
Oh no.
It's only the beginning.
Right. Yeah.
I feel like that's like the epitome of parenthood, starts exactly at birth, where it's like, okay, don't be anxious, but here we go. You have no control over this.
Yeah, that's for sure.
That's awesome. Well, Amber, thank you so much for sharing this with us. I know you guys have a sacredheartbaby.com. People can visit that website to learn more. And I know we featured it on Pensacola Mom Collective, and there's really beautiful pictures out there. I have not seen it in person, but the pictures look amazing and look kind of like you're in your own house.
Yes, it is nice.
Yeah.
It's kind of, you know, bad timing with COVID because we opened it right after COVID. So we haven't been doing any in-person tours, but hopefully we'll get to do that again.
Soon. Well, let us know. We'll come.
Yeah, no problem.
Thank you so much. I really appreciate it, and appreciate you for being here with us today.
Of course, anytime. Thank you.
Thanks.